You are watching McLaren Port Huron today's health program, and in this segment I'm speaking with Dr. Timothy Lukas about treatment options for people with knee pain. So Dr. Lukas, let's start with the non-surgical treatment options for patients.
Certainly, I always start with those options for patients because nobody's rushing into surgery. So non-operative options for knee pain, we'll say related to osteoarthritis. Anti-inflammatory medications to help with the inflammation, help with the pain, analgesics like Tylenol to help with pain, help with the symptoms. I'll also consider doing injections for the knee, cortisone injections, which is a potent anti-inflammatory put directly in the knee to help control some of those symptoms. It doesn't help regrow cartilage, but it can help with the symptoms, and sometimes it lasts a while, so sometimes it can buy people more time. There's also lubrication type of injections that are an option for people. Some people get good results with that, and sometimes they can buy some more time. Therapy sometimes to stretch things out, to strengthen things can be helpful. Using simple braces like a sleeve or a simple hinge knee brace, sometimes that extra support can help a lot with the symptoms.
In our last segment we showed an x-ray of a normal knee, and in this segment you have a picture of a knee that depicts osteoarthritis.
Yeah. So again, osteoarthritis is wear of the cartilage. So when we look at this x-ray, we see that the space between the femur or the thigh bone and the shin bone, there's really no space left there. So they've worn that out, so you've got bone-on-bone arthritis. Along with that, you can get some spurring. That's the body's reaction to not having enough cushion. But you can see even on the lateral, the outside of the knee, there's narrowing of that space too. And if you had the other x-ray of behind the kneecap, you'd see that there's wear of that cartilage surface too.
So let's talk a little bit about what the surgical options are that are available.
So for the knee, again, has three compartments: the medial, the lateral, and then behind the kneecap of the patellofemoral. So if patients have wear of two of those three compartments, knee replacement is usually their best bet in terms of eliminating pain, recovering, and durability. So
what happens during a knee replacement surgery?
So I did bring a model. A lot of times, patients will come in with the misconception that when we do knee replacements, we actually chop the knee out and just put a new knee, and that's not the case. It's a little more elegant surgery than that. So if you look at this model, this would be the end of the thigh bone. So what I end up doing for the knee replacement is I shave off about a ½ inch of the worn out cartilage and bone from the surfaces, make a perfect fit, and then we actually cap that surface, and there's a cement or grout that goes in between the two that holds those together. And then the same thing for the top of the shin bone. About a ½ inch of the worn out cartilage and bone, cap that surface, and that's held in place again with cement or grout. And then this white portion here represents the new cartilage or the plastic. So the patient's normal anatomy or ligaments on the outside of the knee, those are still intact, and they're holding the knee in place and helping it track normally and function normally.
And this image then depicts what the x-ray changes would be.
Yeah, so this is this exact same process in a real person. A cap on the thigh bone, cap on the shin bone, and that plastic liner in between. And that's what gives pain relief, getting rid of the pain-generating portion of the knee.
So what are the advantages of a total knee replacement surgery?
So the only reason to have one done is for pain relief, and it's very reliable in terms of pain before surgery and pain after surgery. I wouldn't say everyone is 100% pain-free, but the difference between those two levels is pretty stark, and it allows people to get back to their normal function and their normal activities.
So really it's a determination, again, when we talked about the hip pain, when it really starts to interfere with their activities of daily life.
It's a quality of life decision that people make.
Yeah. So what is the anticipated recovery period for someone after a total knee replacement?
So that has actually changed over the years. It's improved markedly, just like the hip, and a lot of different reasons for that. One reason is that we're doing different types of anesthesia after knee replacement. We're doing nerve blocks to help minimize the pain afterwards. We're injecting local or numbing agents inside the joint during the surgery, so when you wake up and you're ready to get moving, it doesn't hurt as much as it used to. So it allows people to get up and mobilize faster. So most patients are going home the next day. Some people do go home the same day if they're the right fit and patient for that. But most people go home the next day. you're on a walker 1 to 2 weeks, but able to put full weight on that joint. When you go home, you have visiting therapy, visiting nurses, watching your progress. I still use CPMs for knee replacements, so that there's a machine that's helping that knee moving faster. Some people will do some outpatient therapy once they're done with their in-home therapy for a month or so afterwards.
So, I mean, really, the therapy is an important piece to the recovery
Yes,
as well.
yes. The therapy, the motivation of the patient play a key role in recovery after this.
So how long do knee replacements typically last?
So that's a loaded question. It's very difficult to answer. There are a lot of variables, just like with the hip. One is age, activity level, a patient's weight plays a role. But the materials are better than they used to be, and they're more durable and they're lasting longer. I'd say average for, I mean, if you had to ballpark for any patient that had a knee replacement, 15 to 20 years is a reasonable expectation. Not to say some people don't get more and some people get less, but that's a reasonable expectation.
So do you have any closing comments or anything else that you would like to add?
Yes, I'd like to tell people, if you're suffering from hip or knee pain, get it checked out. Invest some time in yourself, get things checked out so you know what you're dealing with, you know what the process is, and you know what your options are. Because hip and knee replacement done for the right reason can really be life-altering.
Great. This has been really good information, and thank you so much for speaking with us today.
Thank you for having me.
And thank you for watching McLaren Port Huron Today's Health Program. If you have questions about the program, you can call us at 1-800-228-1484. You can order a free copy of the program or access reliable health information through our website at www.mclaren.org/PHTH. As always, be sure to tune in next week to Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.